Hi, everybody. I am Jennifer. I'm the membership chair of Behavioral Health Network Nutrition, DPD, sorry. And Marissa here is our IDEA liaison. So she's going to talk to us today about some equity in nutrition and community nutrition, right? Oh, yeah, there it is. All right. So go ahead, Marissa.
Okay. Hello, everyone. Yes, I'm the IDEA liaison, as Jennifer just mentioned. And so today I'm going to be talking about public health nutrition and community nutrition and kind of how it relates to BHN. So some overlapping qualities. So this is near and dear to my heart because it's something I studied in school. So just to be on the safe side, is it showing the presentation right now?
Yes. Yep, you're good.
Okay, great. So we're going to talk about just like overall definitions and some things that are key to the concept of public health, nutrition, and then get into like some overall programs and some emerging ideas of programs in BHN. Okay, so I have just some definitions here of what exactly public health nutrition and community nutrition are. This is from a recent paper from the Academy, the Standards of Practice and Professional Performance for RDs in public health nutrition and community nutrition. So this is the most recent version. So public health nutrition, as you can see here, it's basically public health, so prevention of disease and promotion of health, but from a nutrition lens. So you can see it's very broad, programs, systems, policies from a population level or like a targeted group level, like not just on an individual level.
Marissa, did you change the screen? Like, are we supposed to be able to see the definitions?
Yes, maybe is this not going through?
There you go.
Oh, maybe I have to like gloss over it or something. So yes, here are the definitions. Yeah, just let me know if there's any glitches and I can just kind of redo them. And community nutrition is very similar, but it's kind of on a smaller scale level, usually like within a specific community. So for example, if you are responsible for evaluating a big program like WIC, then you might consider yourself to be a public health nutritionist. But if you are a nutrition educator working one-on-one with patients in the WIC program, you might consider yourself to be a community nutritionist. So very similar, just kind of the scope that's different. So kind of use them almost interchangeably. So can you see here the 10 essential public health services? So this is from the CDC, and this is the framework for what public health professionals do. And we use this also for public health nutrition. So you can see that there's 10 services grouped between assessment, policy development, and assurance. So from assessment, getting to know the population and what the problems are and the underlying root causes of health problems. Policy development, so communicating with your population and really developing these relationships, partnerships, and coming up with programs or policies, and then implementing them. And then assurance. So this is, I like to think of it as making sure that everything's like running smoothly. So making sure you have a strong, a competent and diverse workforce. And then, all the important steps of doing research and evaluating the program that you might have implemented and those quality control measures. So you can see in the center that equity is kind of what ties it all together, what's central to the services. And when I was in school, this was actually a very different graphic that they changed recently to kind of emphasize how important equity is, and making sure that we, get rid of any sort of barriers to the care that we're providing and making sure that it's accessible to everyone. So what is equity exactly? And I like to use this graphic because I think it just like really easily highlights the difference between like equity and equality. So you can see that we have 3 people, different heights, and 3 boxes. So those are the resources. So equality would be, we have 3 people, 3 boxes, we share everything equally. Each person gets a box. You can see that in this example, they don't have the same needs. So the first person can more than see everything, and the last person can't still see what's going on. So equity instead is looking at the differences in needs and redistributing things based off of the inequities. So we have, 3 boxes, but the first person really didn't need one. So instead we give it to the third person so they can see. So equality is great, but while we still have differences and, advantages and how people live their lives, it's important to address these so that we can achieve like more just healthcare. So now I'll move on to the social determinants of health, which are really tied into equity, kind of expose like what's going on to cause inequities in our systems. So this is a graphic from the CDC, or sorry, that the CDC uses, but it's from the Healthy People series. So it shows the 5 overarching domains of the social determinants of health. So you can see the different colors, that these are factors that can affect health that aren't what we think of as being the cause. So we usually think of things like genetic factors that lead to health outcomes, or our biology. But these are things that are more social, more like our environment. So you can see the 5 categories are education, economic stability, social support, the neighborhood or built environment, and access to healthcare and the quality of care. So these are the 5 categories, but you can see that they're kind of related, right? So if you don't have the opportunity to achieve a higher level of education, say maybe you don't have the financial abilities to support your education, then you might not be able to find a high-paying job, and that might affect where you live, the neighborhood that you live in, and that could then affect, how you access things like food, that healthy food, and it could even affect, if there's hospitals nearby, so your access to healthcare. So these are all their own categories, but they're kind of related too. And then, of course, you have social community support. So like if you have a good support system and people around you. And I looked into social determinants of health, like related to BHN, and I found some articles that kind of presented some ideas for like our different pillars that we could consider as like barriers for our population. And this one is from this year from World Psychiatry, and they found some factors that are kind of similar to determinants for physical health, but this is considerations for mental health. So I think that socioeconomic status is pretty much always going to play a role in your health. So also playing a role in mental health and your overall stress. They found that prenatal adverse events and childhood adverse events were related to mental health, mental illness, and also substance use. So maybe things like whether you're bullied or had trauma, the neighborhood around you, again, might be a stressful environment. Migration or refugee status, which they found was related actually to psychotic disorders, and as well as PTSD, especially considering where people might be coming from, the situations. And then discrimination of any form was associated with, mental health. So whether it's based off race and ethnicity, or being a member of LGBTQ, without like a good support system, or isolation and loneliness. So these also are not isolated. So you can imagine someone could have more than one of these determinants. So someone coming from a different country could experience discrimination based off of where they're coming from, their race or ethnicity, could experience isolation and loneliness based off of how big their community is, of people that they can communicate with. So you can see that this can kind of compound. People can have more than one thing that they're experiencing. Let's see. And then for IDD, there was an article that was specific to the Delaware Journal of Health. So this was 171 different stakeholders, so either patients or caregivers or members of the IDD community there, that they interviewed to see what they felt was a barrier to their health. And so I thought this was interesting. So I guess maybe I should have mentioned that. I tried to color code it based off of the wheel here. So these are just like little color coded pieces of the wheel. But sorry, I think I went back. So yes, for IDD, they found that access to plain language information and resources, and quality healthcare where people actually understood, where they're coming from. These were really important considerations. Also, sadly, the environment, whether they experienced abuse in their community or unnecessary intervention from police. Accommodations in school not being adequate, and community support or programming. So, and the researchers thought that this could have been that there were resources available, but they weren't connected to them. So some people didn't realize that they had resources that they could use. Job training and affordable housing. And then for disordered eating, there was this article here from 2022. They looked at, I believe, over 1,500 emerging adults that participated in this longitudinal EAT study. And they built like a framework for different social determinants and like cluster them in different groups for like who would experience specifically disordered eating behaviors. So not diagnoses of eating disorder, but just the behaviors of binge eating or weight restriction, weight control behaviors. So some things that they found could contribute to the disordered eating patterns were food insecurity and government assistance, which was interesting because they thought it might be that sometimes you have, the money comes in and you're able to get your food, but then that might run out. And then so that might create like a feast or famine cycle that affects how you eat. Financial difficulties, again, this is pretty much just pervasive through all of these, and can cause stress that might lead to binge eating behaviors. Discrimination, especially appearance-based teasing, like weight-based teasing, that can cause internalization of these stigmas and make you feel like you need to do these like weight control behaviors. And neighborhood disadvantage. And this one was interesting to me because they kind of presented that it could be from like if you don't live in a neighborhood with a safe access to being able to move outside, then they may resort to like more compensatory eating behaviors because they can't get that movement in, so they want to manage their weight some way and use like weight control restrictive behaviors. Okay, so that social determinants of health model is from the Healthy People series. So I just wanted to talk kind of briefly about what that is and how you can use it as a resource.
I can't see the image.
Oh, yes. So this image from the social determinant, sorry. from before.
Oh, I'm sorry. I thought you said there was another one. I'm sorry.
Oh, you're fine, you're fine. I was just, yeah, so this image with the so that's from the Help You People series. So this is the Healthy People series. Now we're on 2030. So it comes out every 10 years and it provides like objectives that are national objectives. And they provide data to show if we're meeting the objectives, you know, or like how close we are, and to track the progress. So it's really useful to see like what our health priorities are, how on a national level, if we're meeting them or not. And then you can like compare your local community, like say you have numbers on food insecurity and you want to see how it compares to like the national average. So they also have evidence-based resources, things like tools and successful programs are related to their objectives. So they're grouped based off of health conditions, health behaviors, settings and systems, and the social determinants. So I'm going to try to make this graphic pull up. And so you can see I've like kind of highlighted the ones that I thought were related to behavioral health. And so under health conditions, they have addiction, they have mental health and mental disorders. I was just curious about overweight and obesity, but yeah, it's not, they don't have underweight or anything. And they have under health behaviors, drug and alcohol use, and nutrition and healthy eating. So there's a lot of different objectives with a lot of different topics. So here's an example of one that is more related to behavioral health and nutrition. So the objective is to reduce the proportion of people with intellectual and developmental disabilities who live in institutional settings with 7 or more people. So the justification is that, you know, these really big like community living centers are associated with like poorer quality of life. So we want to reduce the number of people that are in these settings and make it smaller areas where they have more access to, you know, family and the resources they need for like social activities. Everything is like on a smaller level. So yeah, you can see now that the data there, it shows that it's improving because it was at 22.7%. Now it's at 20.8%, but it's still not where it needs to be, which our current goal is 11.5%. So you can kind of see like where we are with these objectives. Yeah. So gonna move on to cultural competence, which is another really essential component of public health and community health. So the reason why cultural competence is so essential is that, you know, it is necessary to provide care that's equitable. And we saw how important like equity is to public health. So to put really simply, cultural competence is the ability to interact cross-culturally. So providing different adaptations for the group that you're working with. Different components might be like self-awareness. So checking in with yourself to see how your perspective and worldview might differ from the people that you're working with. Maybe they don't have like the same privileges as you, making sure you don't have any biases towards different groups, and just considering those differences and how you might need to make changes, but also being open to learning about different cultures. So this is very continuous. It doesn't happen overnight, and it's never going to be like perfect because we can't know everything about every culture, but just having that openness to learn. And then linguistic competence, so that's more formal, like being equipped with certified interpreters, having materials for limited English proficiency, so which can also be helpful for lower health literacy, right? So having these materials like just a very clear, understandable level, or ideally in a different language if that's the population you're working with, which I know can be challenging depending on our setting. Like if you're working at a hospital with like Joint Commission standards, that's probably going to be a little bit easier for you. But if you have like a private practice, it might be difficult. So it's just what you can make do with. So this is important because, you know, we always think of culture as just like different groups, like people who have like the same language and music, but you know, everybody has their own cultural identity and it encompasses like so many things. So you can see here just some examples of categories of how people can have different perspectives and might need, you know, some changes in how we provide care. So kind of an example I like to use for cultural competence, like on a scale, would be, you know, if we have, you're starting a nutrition education group in your community, maybe for like refugees. If you don't have like a very culturally competent service, it could be just recycling some old like materials that you had for this nutrition education group and not making any changes. More culturally competent would be, you know, taking these resources and seeing if we can add cultural foods or, you know, maybe some different customs that we need to take into consideration, maybe even translate it if possible. And even better cultural competence might be to, you know, collaborate with someone from that group, like a stakeholder from that whatever country they might be from, and get more insight on the culture that way. So yeah, I think it's just really important to think about where people are coming from in all of these categories and just try to respect that and incorporate it into like the tailored care that we provide. So here are some resources for cultural competence that are specific to behavioral health. The first one is the Health and Human Services Office of Minority Health collaborated to make this training that's improving cultural competence for behavioral health professionals. So it's really like from the lens of a behavioral health like practitioner, really more for like mental health, like for counselors, but it's still like similar enough to a population that we might serve. Yeah, I think it's really helpful. And they have four different sections that you can, you know, if you only wanted to improve maybe the linguistic appropriate intervention section, you can just do that part. So I found it really helpful personally. And then SAMHSA, so the Substance Abuse and Mental Health Services Association or Administration, sorry. They have these great behavioral health equity resources. So this shows when you click on this link, it has like all of the different centers of excellence they have. So for African Americans, American Indian, Alaska Natives, Asian Americans, and Hispanic, Latino, LGBTQ. So all these groups have their own page where they provide different resources, and it's specific to like providing appropriate care from a behavioral health lens. Okay. Sorry. It's not. So I'm going to move on to just talking a little bit about, sorry, I think I'm on the wrong, about different community public health nutrition programs. So the first ones I'm talking about, you've probably all heard of, but I think they're important to talk about because they're providing access to food for potentially food insecure populations. So food insecurity is a huge problem right now that's gotten worse recently. So it's for households that experience, you know, limited or uncertain like amounts of food, so inadequate amounts of food from safe sources. So right now, and I think this data is from 2022, but it's estimated that 12.8% of American households are experiencing food insecurity, or that translates to 44.2 million people. So it's definitely a problem, and our community, our population is at risk for this, right? So if you work, especially like with mental health, substance use, you might see this population of people that have, lower socioeconomic status, and that might be food insecure. So probably across all of our pillars, though. So I've listed mostly programs that I have personally referred patients to, and they're very common across the US. So for just the general low-income population, we have SNAP, the Supplemental Nutrition Assistance Program. So that provides monthly benefits towards food, and this EBT card. And on a state-based level, they have SNAP Ed, nutrition education. So that can vary by state, but it can be a helpful resource to the participants. So the requirements, the eligibility is income-based, so being within 130% of the federal poverty level. There's also some work requirements, but it's important to note that there are exceptions for mental and physical health, so that might be beneficial for some of the people we see. And there's also like an assets check that's different from the other programs that I've seen, where they can check how much you have in assets. But the eligibility can vary by state too. And then in the maternal child population, we have WIC, so the Special Supplemental Nutrition Program for Women, Infants, and Children. So that services pregnant women, breastfeeding and or postpartum women, children under 5, and infants. So some people don't know that you might also be eligible if you are a single dad or a foster adoptive parent. So you might be able to cover your child if they're an infant or under 5 that way. So they provide nutritious foods, formula if necessary, education, breastfeeding support, and this farmers market nutrition program, which I love because it provides vouchers that people can use at farmers markets to get fresh produce. So the eligibility is a little bit more liberal, I would say. It's less than or equal to 185% of the poverty level. So that's 47,767 for a family of 3. So also to be nutritionally at risk. So maybe having, not an adequate diet, or maybe needing a special formula. So there are many ways to qualify under that. But I like to, share with patients that sometimes they feel like kind of a stigma associated with this kind of nutrition or assistance, government assistance, but it's just a really good resource to be able to afford food, and they provide like education a lot of the times. And some people don't realize that they might even qualify. Like with WIC, that's that's a pretty wide range. So I just always like to share that information. Let's see. And then there's a couple of different programs for seniors. So the first one's the Commodity Supplemental Food Program, which provides food boxes. So all of these, the ones I talked about before and the first 2 here, they're all from the USDA Food and Nutrition Services. So that's like a government, federally funded source. So we have the Seniors Farmers Market Nutrition Program, similar to the one for WIC, provides vouchers for produce at farmers markets for seniors. And then Meals on Wheels, which isn't USDA FNS, but it is in most communities where they provide meal delivery for seniors with limited mobility. And then for slightly more mobile seniors, they provide congregate meals where they can have some social interaction as well. So I was looking for very specific programs that are like nationwide, behavioral health targeting, and also nutrition related. And it was a bit hard to find because I think it's so specific. But I found this one that's called Food and Mood Project. So I don't know if people have heard about it, but it started in 2021. So it's still in the early stages, and it's a collaboration between SAMHSA, there are just 2 regions there, and the UFSDA FNS specific Mountain Plains region. So it's just those states that are highlighted there. But it sounds like a great program because their goal, you can see here, to promote emotional wellness, reduce the impact of mental health and substance use issues in specifically a pediatric population, so K through 12. And then they focus on strategies that you can see the intersection between behavioral health and food insecurity and culturally appropriate foods and school gardens. So it sounds like this really great program that is like perfect for behavioral health nutritionists. And I'm really hoping that, we'll get more data from it, more information on the interventions and toolkits that we'll be able to use in other states, just across the US would be great. So right now, all I could find about it was their website, and orientation here is listed, which is like a slideshow that tells a little bit more about it. And also they have, I think, a presentation on like food and mood and like nutrients of concern available, but I'm hoping there's going to be a lot more coming out. And then I wanted to share kind of more specific programming that's kind of emerging, that it doesn't seem like there's a lot of research on, but it sounds like great ideas for our population. So one idea are cooking programs for IDD. And I think I actually saw on the discussion board, somebody was asking about this. So I might share this on there. But so there were some recent programs. You may have heard of the RAM Chef program. So this was started in Westchester University during COVID. And at the time it was virtual, but I believe now it's in person. And they have cooking instruction for young adults with IDD. So they work with student nutrition coaches, and they can kind of develop their cooking skills, which helps them for job training if they want to stay in that field. It helps them with, learning a skill so that they can support their own healthy lifestyle or of their families. So I think it's really great. It says that the goal is to foster independence and self-determination for that population. And then there was another program in kind of a very specific community mental health center in Kentucky. But I was looking for everywhere. And they use Cooking Matters to provide cooking classes for their adults with developmental disabilities. So Cooking Matters is a free resource online that provides, information on cooking, nutrition, budgeting. They also provide lesson plans, so on how to cook, specifically for parents and kids and caregivers. So I'm not sure if this program like tailored it or if they just used it as is, but it's a really great resource if you're interested in a cooking program. And it's all free materials. And then another consideration for like an emerging program for behavioral health is therapeutic gardening, or also known as horticultural therapy. So you may have noticed in that Food and Mood project, they have school gardens is a component. So gardening's been used a lot in schools for, helping to promote fruit and vegetable intake in kids, and also in like communities to decrease stress and promote mental well-being. But surprisingly, it hasn't really been used in the behavioral health population, despite like all these benefits. So there is a program though in UNC that I found where they have a center of excellence for community mental health. And so they have their patients that have these serious mental health conditions that actually take part in this program. And it's supposed to have different components like gardening and nutrition education, and they can maybe like get produce at the end for a small fee. And so another similar well, I just want to mention that they also have training online that they collaborated with Extension to make, but it's not free. So I didn't list it here for any financial conflict. But there's also this program that's listed here that was very, it's very small sample size, but it was an Italian study where they looked at horticultural therapy for anorexia nervosa, but again, very small, just 12 females. But they found, in a very qualitative manner that it might improve stress, but they didn't have, enough statistical power to show like any changes really. But it is a consideration that I'm a little biased, I guess, because where I used to work at a inpatient psychiatric facility, and I started a gardening program there, and nutrition education for the adults and the kids. And then in school, I also did gardening programs. So I really like the idea of this. I think that you can see like that people connect with food that way when they have this like ownership of, starting from seed and being able to, take part in growing the food with watering it, harvesting it, and then eating it from that way. So I really like the idea of these programs. And I hope that we can see some more information and more data from it. Okay, so how can we get involved with improving the health of our communities? So one way is to, take some cultural competence training, maybe the one that was listed or, any that you know of. I personally think even if you just take some time to reflect on your experience, your background, and your patient populations, and just take time to think about, any gaps that you might have and how you can better serve them. That's great too. So I really like the training that was listed, but anything is better than nothing. So another possibility is to compile a list of community resources that you can share with your patients, especially if they are experiencing, housing problems or food insecurity. Things like food pantries can be really helpful. That would be on the local level, different programs that might help connect them with food. And also wanted to share that this could be like something that your hospital already does. So my hospital would pre-populate this. So it might already be a resource that's available to you. But I always like to tailor it with more information because there's always different community organizations popping up. So it can be helpful to just make it as specific as possible. And also like with the programs that were mentioned earlier, it doesn't always have to be on you. Like if you want to work with the social worker, sometimes that's more something that they can help with, especially getting them connected with actually like participating in these programs. But as the dietitian, you could identify that this is an issue. So I just wanted to point that out. And then you can start a community nutrition program. So maybe nutrition education, maybe one of the, like IDD cooking or gardening programs. But that could be, even at your place of work, you could maybe provide more education and see all of your patients at once to really help the community. So, and if you do that, it would be very helpful to provide an evaluation and share results because as you can see, there's just not that much information at the time. And finally, you can advocate for health equity. So that could be, something simple like we always have those action alerts that come through. So you click a button and that pre-populates to your legislators, or raising awareness of issues that are in your communities, or, actually working with your local leaders and legislators to try to promote change. So advocacy exists on many different levels, depending on what you have time for in your life. Okay, and tried to leave some room in case you guys wanted to kind of have a discussion, maybe share, some things you've done in the past, or if you had any questions, I can try to clarify some more.
Okay, I'm gonna stop the recording before we do that, so everybody can feel comfortable.